Sarah Keep from By Design Optometry, and this is one of my staff members, Jenny. Thank you for joining us today, Jenny.
Hi.
I'm an optometrist here in Edmonton. We do provide routine eye exams, but we also do vision therapy in Edmonton. And specifically, I really enjoy doing post-concussion rehabilitation. There are over 300 connections in the brain that have something to do with vision. So it's not surprising that a lot of patients who suffer from a concussion actually end up having visual issues following that concussion. So when I'm doing a routine eye exam, it's not uncommon for patients, they come in and we do their history and they say everything's great and they have no concerns and they have no medical history or anything like that. But as I start to work through the exam, they have these, sort of abnormal exam findings that, lead me to believe that maybe they had some sort of trauma or, have maybe suffered from a concussion. And then when I do ask them, they do mention that yes, they, have in fact had a concussion that happened, recently or even years prior, that they never thought to even bring up when we did our medical history because they weren't even aware that the symptoms that they were experiencing were actual visual symptoms. So I wanted to spend a little bit of time talking about what can happen to your visual system after you sustain a concussion.
All right. What are some causes of a concussion?
So a lot of patients think that you have to have a head injury to have a concussion, but that's actually not true. So any sort of force that's a large enough blow where it actually causes your brain to kind of jolt around. So this can be, it can be a blow to the head, but it can actually be a blow to the body. So any force significant enough to cause, shearing or trauma to the brain inside the skull can actually cause a concussion.
What are some common visual symptoms of a concussion?
There's lots of different visual symptoms. So they can be things like headaches or eye strain associated with near work. Patients often experience things like dry eye. They often don't blink as often as what they should. So dry eye symptoms are really common. You can experience blurry vision or double vision, particularly associated with reading as well. Difficulty focusing up close or sustaining that focus up close is really common. Losing your place when you're reading or having difficulty with things like tracking a ball, for instance, can be really common. There's also lots of other symptoms that patients don't realize are visual symptoms. So things like balance issues can be from a visual origin. Things like dizziness or nausea, especially associated with visual motion. So, these are patients if you have a child and they go to school and when they get up to walk through the hallway and there's, fellow classmates rushing past them, that causes a lot of symptoms, or, driving in a car and having cars kind of rush past you, or walking through a busy shopping mall. These are all situations where there's a lot of visual motion, and if that causes discomfort, those are actually visual issues following a concussion. Patients often can have things like light sensitivity. This can happen indoors or outdoors. We see them often in environments where there's things like fluorescent lighting because there's a bit of a flicker rate to the fluorescent lighting, so it causes that visual motion hypersensitivity and stuff like that as well.
Okay. Yeah. What is neuro-optometric rehabilitation?
So neuro-optometric rehabilitation is a type of vision therapy program that basically enables us to retrain the brain and how the visual system works. So it's kind of like physiotherapy for the eyes. So we do different visual activities, but we incorporate them with other sensory motor activities to try to basically reteach you how to regain these visual skills. This can often reduce the visual hypersensitivity that patients experience following a concussion, and it can also improve visual skills like we often will see ocular motor issues or eye movement issues, tracking issues, eye teaming issues like convergence problems where you have difficulty moving your eyes in to do near work, or accommodative issues or focusing problems. So we can work on all of these visual skills. I always like to incorporate them with other skills like have a cognitive component, or we can add in some auditory or vestibular or balance type stuff as well to kind of integrate them with other systems of the body, because this really helps to kind of ingrain those visual skills, which can have a dramatic improvement on reduction of symptoms in patients who have a concussion.
How does vision therapy help with concussions?
So when a patient suffers from a concussion, there's often diffuse damage to the brain. So you can have shearing of axons in the brain, and they can happen through all sorts of visual centers. There's so many connections in the brain that have to do with visual processing. So there's 32 areas of the brain that have to do with vision, and there's actually over 300 connections, as I mentioned before, through these visual areas. So you can imagine that if there's diffuse brain damage, there's often significant visual symptoms associated with them. So if we can retrain patients how to use this visual information more effectively, it can have dramatic improvements on their day-to-day functioning.
What is the first step in the vision therapy process?
So the first step for patients is we book them in for an assessment. So these assessments can be quite lengthy. Sometimes they're anywhere from 1 to 3 hours. We do a variety of tests to see, how efficiently their eye muscles and stuff like that are working, and we do visual processing tests. And then obviously we need to look for potential trauma that occurred to the eye or to the brain. So we do things like visual fields and stuff like that on patients. Sometimes the first step is something simple like prescribing glasses. So because there's lots of visual hypersensitivity, even really minor glasses prescriptions can sometimes have dramatic effects for patients. We utilize special tools, so we can use things like special prism, which can help with balance issues. We can use different tints, which can really dramatically reduce visual hypersensitivity. So sometimes the initial steps of treatment are just prescribing glasses, so it's really quite easy. For patients who are more symptomatic or we don't have enough of an effect from glasses alone, then we would start them in a formal rehabilitation program, which is different depending on the patient and kind of where their symptoms and what damage they have.
After the initial first steps, how long is the vision therapy process?
That's a great question. That's something patients often want to know. It's very dependent on the patient. So some patients, they just need a couple of vision therapy sessions, and that's all they really require to just have a little bit more efficiency of their visual skills. Other patients, you can imagine if there's really diffuse damage to the brain and where there's significant trauma, sometimes we have to make a lot of accommodations to the activities to even get them to be able to perform the activities. And obviously in this case, a therapy program is going to take much longer because we want them to get to the point where those visual skills that are very challenging in the beginning become automatic as we integrate them with other sensory motor activities as well.
Okay. Are the results long lasting, or can the symptoms reappear?
So we do actually find that the results typically are long lasting. So once you regain the use of these visual skills, they do typically last for significant years to come. In fact, the only thing I caution patients is once you have a concussion, you're actually at a greater risk to sustain a greater concussion or a subsequent concussion. And the damage that's done with these subsequent concussions can sometimes be more severe than prior concussions. So, certainly if you do a vision therapy program and then sustain additional trauma, the symptoms can return. But for a patient where they don't sustain trauma, the effects from a neuro-rehabilitation program are actually quite long lasting. Yeah.
How do these different types of rehabilitations work together to help concussion patients?
So that's a really great question. So I always believe in a multidisciplinary approach for concussion rehabilitation. So patients do often need rehab programs from other professionals as well. So we often have patients who are seeing a physiotherapist or a neurologist or a psychologist or an occupational therapist. And it is really important to be able to work through these programs and to have the professionals communicate with each other so that we know where everyone else is at in their rehabilitation program. So sometimes for optometric rehabilitation, it's important to do that either simultaneously or even do it before you do some of the other programs. For instance, we sometimes have patients where they have significant balance issues from things like a visual midline shift. And if they're going through and having physiotherapy done for balance issues, but their visual midline is shifted, if we can fit them with lenses or prisms, it actually makes the physiotherapy activities significantly more successful. So sometimes we do want to do a little bit of vision work before they can, progress, more efficiently through other rehabilitation programs. Other times we want to, do the same where we kind of take a step back and let them work through other rehab programs. So for instance, if they have significant vestibular issues, they might need a little bit of physiotherapy first before we can effectively start our vision rehabilitation program. So as I mentioned, like a multidisciplinary approach is really the most effective approach for successful treatment for rehabilitation for concussion patients.
How can someone get started with vision therapy at your office?
So as I mentioned, we always have to bring them back to do an assessment. So if you feel like you're suffering from visual issues from a concussion, feel free to give our office a call at 780-444-6407 to book an assessment. As I mentioned, the assessment can be lengthy, so they're anywhere from 1 to 3 hours, and we do sometimes break them down into 2 separate appointments. So the first step would be to have that appointment done so we can see if there are actual visual deficiencies that can be trained on, and then we can go from there to see if a patient would benefit from doing a formal neuro-optometric rehabilitation program.
Great.
Yeah. All right, I hope everyone found that to be informative. We're really excited to perform vision therapy in Edmonton, particularly neuro-optometric rehabilitation. It's really rewarding. It's great to see patients and how far they can come as they progress through their vision therapy program. If you're interested in learning more information, feel free to subscribe to our channel. Otherwise, I'm Dr. Sarah Keep from By Design Optometry, and this is Jenny. We'll see you guys next time.
See you guys.